Okay, so I'm going back into my patient's room. As I go in, I do hand hygiene and I do a safety check. So that includes bed breaks, bed rails, call bell, safety equipment. Yes, for the purposes and patient privacy, for the purposes of this video, I've set the bed to a height to work for me and I'm going to keep it there the whole time. Hi, Mrs. Wilson. How are you doing?
Good.
Good. So, do you remember how the physician just came in here and he mentioned the crackles in your lungs and the swelling in your ankles?
Yep.
Okay, so he has prescribed you a medication. It's called Lasix, and it's going to help hopefully move that fluid out of your lungs back and out of your ankles back into your system.
Okay.
So you're going to begin to pee a little bit more like you were before you had this issue, and hopefully it will help. Now, before I go, do you have any questions about the medication?
No, I don't think so.
Okay, that sounds good. So now I'm just, before I leave and get everything ready, I'm going to make sure that the IV site appears to be patent. So there's no blood around the dressing. I'm going to palpate for any extremely unusual coolness or heat, any redness or kind of white. I'm also going to palpate the vein. It shouldn't be hard, which it's not, and any signs of exudate, which there isn't. There's a date on here, so that's all good as well. And yeah, I'm going to leave the room and get the medication ready. Okay, so as I leave, I do a safety check as well. I'll be right back with your medication, Mrs. Wilson.
Okay.
Okay, so I come back to my cart and I perform hand hygiene. The first thing that I do is I check the doctor's order. So there is an order for 20 milligrams of furosemide. Great. Then I'm also going to get my MAR for the patient, and I'm going to get my IV monograph for furosemide. I'm going to check the IV monograph. Yep, it's furosemide. Oh, there's an elder alert, so I have to watch for a loss of sodium or an increase of urea, which can cause confusion. So I'll have that in the back of my mind. Any changes in mental status, I'll be kind of looking out for with this patient. I go down to the administration, direct IV in adult. So for a dose less than 120 milligrams, I can give it IV direct as a registered nurse over 1 to 2 minutes. Because she is an elder patient, I'm going to do 2 minutes. Monitoring, there is none. I'm going to look over the rest. We're not reconstituting. It is compatible with normal saline. She has a normal saline lock, and I'm going to flush with normal saline, so that's all good. And I will briefly look over the adverse effects. The dose for an elderly patient is initially 20 milligrams, so that all lines up. We're ready to go. We're done with the IV monograph. So now what I'm going to do is I'm going to get my supplies. So 2 saline flushes, and as I grab them, I'm just going to confirm that it's 0.9 sodium chloride, 0.9 sodium chloride. So they're in their packages. Hopefully you can see that. Okay, I'll put those aside. I'm going to get my medication. For the purposes of this video, this is not sterile in its package, but in practice, it definitely would be. I'm going to get some alcohol swabs, a medication label, a needle with a filter, a red stopper, and that's everything. Okay, so I'm going to write out my 7 rights on the bottom of my MAR. So that's right patient, right medication, right dose, right route, right time, right reason, and right documentation. Okay, great. And I've got my furosemide. Now in this vial, I will show you, it says there's 40, it's furosemide. 40 milligrams per milliliter. Now I reference my MAR, and it's a 20 milligram IV. So if there's 40 milligrams per milliliter and I need 20, I need to draw up half a milliliter. So I'm gonna go ahead and do that. I'll make sure that I get out all of the medicine from the top, and I'm going to get an alcohol swab. I'm going to open this medication away from me, crack it. The sharps container is full, but I put this right into the sharps container. And now I'm going to get my syringe. I've got a 1 milliliter syringe, and I'm going to get my filter needle. Okay, now I'm going to remove the cap and draw up 1.5 milliliters.
Okay, so I've got my furosemide here.
Okay.
Furosemide, 40 milligrams per mil. So I've done my med math, which is 20 milligrams divided by 40 milligrams.
Okay.
No.
So I'm just going to put on the cap here and just try to hit the bubbles out.
I'm going to say these are all dry.
This is a really overused syringe, so I've got to be pretty aggressive here. Okay, but it looks like all the air is at the top, so that's great. I'm just going to take this off, and then I've got my little spillage area, so I'm going to go back.
Breaking this away from me and turning my
Okay. And now I will recap this filter needle, and I can remove the filter needle, and I'm going to put on a red stopper just for going into the patient's room, just so that it's not intimidating. So now that I've got my 0.5 milliliters, I'm going to do my 3 checks, and for the purposes of just moving fast here, I'm going to start by showing you that I've got 0.5 milliliters.
Just 1 second, it's not. Okay.
So can you see that?
Yeah.
Okay, great. So now I'm going to do my 7 rights, 3 checks. Okay, so I am going to make sure that this is the right patient's MAR that I'm looking at. Rita Wilson, right, okay. The right medication I've just gotten, it is furosemide. Great. The right dose, there's a 20 milligram ordered on this MAR. There was 40 milligrams per milliliter, so I'm going to be doing 20 milligrams, which is 0.5 milliliters. Yeah, that's 0.5 right in there. Great. Right root is IV. I'm going to be giving that through her saline lock. Right time, it was ordered at 7:45. That's the time right now. The right reason is for fluid imbalance, crackles in her lungs, low urine output, and swelling in her ankles. I will document later. I'm just going to do 1 mark for my first check. Okay, second check. Is this the right patient? Rita Wilson, yes. Is this the right medication? Furosemide, yes. Is this the right dose? She got ordered 20 milligrams. There's 40 milligrams per milliliter, and there's 0.5 milliliters in here. That is right. Right route, it is IV. I'll give it through her saline lock. Right time, okay, it was ordered for 7:45 right now. Perfect. Right reason, for the reasons I just specified, fluid imbalance. I will document later. I'll do a little dot here. Second check. Third check. Rita Wilson is my patient. Perfect. She got ordered furosemide, right medication. Yep, okay, furosemide. During the last check, I like to just visualize the expiry date. Great, it hasn't expired. Right dose, they ordered her 20 milligrams. This is 40 milligrams per milliliter. I'm going to be giving her 0.5 milliliters. That's in my syringe. Right route is IV. Wonderful. Right time, it was ordered stat at 7:45. That's the time now. Wonderful. Right reason, fluid imbalance. Great. So at this point, I sharps container this. That's all full, so I can't do that. And I'm going to make a medication tag for the syringe. So the information that I'm going to include on here is the right patient, Rita Wilson, the right drug, furosemide, the right amount, 20 milligrams per 0.5 milliliters. I'm going to give my initials and my BSN2 status. I'm going to write the date and the time. So I already did that for the purposes of time in this video. I'm just also going to show you. Wonderful. Okay, so you've already visualized in the video this syringe and that we have 0.5. So I'm going to put this medication label on so that I can still read the dosage amount. Okay, so I put that on. Great. And now I am done here. I can just kind of tidy my cart. I've done my 3 checks. I'm going to bring my MAR into my room with me, my medication, the saline flushes, and some alcohol. Hi, Mrs. Wilson. How are you doing?
No, I'm good.
Good. So I've got the medication here. Before we begin, do you have any questions about this medication?
Nope.
Okay. And do you have any allergies that you know of?
Nope.
Okay, great. And can you please give me your full name and your date of birth?
Rita Wilson, January 26, 1945.
Great. So that lines up with our MAR, and I'll just give a little check of her wristband. It also lines up with her wristband. I'm going to do some hand hygiene here. I'm going to open my saline flushes. I've got my medication here. Okay, now what I'm going to do is I'm going to clean the port. So I'm going to do that for 30 seconds. Okay, I'll be done that for the purposes of this video. And then I'm going to kind of keep my hand on the Y side. I did just touch it, so I'm going to clean it once more. I'm going to clean it for 30 seconds. No problem. If I touch it, I just clean again. I'm going to unlock this, and then I'm going to screw on my saline flush. I'm going to do a drawback, visualizing for any blood. That might not happen, no problem. If there's no other concerns, I'll go ahead. So I'm going to do a push, and I'm going to push about 3 milliliters. I'm reading the patient for pain. I'm feeling the site to see if I can feel it going in the vein. And I'm also watching for any raises in the skin around the site. So I've done about 3 milliliters here. Was there any issue there?
No,
Mrs.
perfect.
Wilson?
No pain.
Okay, great. So I'm going to unscrew that. Okay, now I'm going to get my medication. I'm giving this over 2 minutes, and I've got 0.5 milliliters. I'm going to alcohol swab the Y side again. 30 seconds for the purposes of this video. I'll be done. I'm going to connect the medication here, and then I'm going to visualize the clock near the base of the bed. And I'm going to be giving 0.5 over 2 minutes. So that's about 0.12 over 30 seconds. So here we go. I begin to watch the clock and I administer.
Still in the same room. Hello. Hi. Can I get your name, please? Rita Wilson. Okay, your date of birth, January 26, 1945. And do you have any allergies? No allergies. Okay. Okay, so I have Furosemide here for you. So this is a diuretic. So what that means is that it is going to make you pee, and it'll help get rid of excess fluid. Before I start, do you need to go to the bathroom? No, I'm good. Okay, so...
Okay, so we're just at about halfway there, and I'm about halfway done the administration, so that's great. How are you feeling, Mrs. Wilson?
Good.
So, like 30 seconds, and yeah, I'm going to leave that for 30 seconds to dry. And I'm also just assessing the IV site. I see here that that it looks like it is not, there's no phlebitis, and there's no infiltration, there's no edema, there's no inflammation. Just check. The temperature is the same. I'm just going to wipe this again. Sterile. Okay, so I'm just going to open this up.
Okay, so we're just at about the 2-minute mark, and I've finished. So there's that medication, Mrs. Wilson. You're doing okay?
Yeah, I'm doing great.
Okay, now I'm going to re-saline lock. So I'll unscrew this, cleanse my Y site one more time, hook up the saline flush, and for about the first 3 milliliters, I'm going to do the same time that I did for the med administration. For the purposes of this video, I'm just going to do it. So I do it 3 milliliters, same rate, and then when I'm done that, I'm going to do one more push, and as I'm pushing, I'm going to relock the saline lock. So that's good. Okay, Mrs. Wilson, I'll be right back to check on you. Do you need anything?
Nope, that's it. Thank you.
Okay, great. So now I'm going to go back to my med card and document. So to document, I'm going to write the time, 7:45, my initials, SE, BSN2, and I'm going to write ID next to the time for initial dose. There we go. Was it under 15?